We are in day 21 of National Ovarian Cancer Awareness Month, and if you've been watching the show over the years, you know that I am a survivor of this deadly disease, thanks be to God. And today I am so honored to welcome my gynecologic oncologist, Dr. Georgia McCann with UT Health San Antonio, and Maria Gonzalez, who is my fellow Teal sister, a ovarian cancer survivor and warrior, as I call her. Thank you both for being here.
Thank you for having us.
Absolutely. So Dr. McCann, let's get to it because I'm really proud of your work, and you're working on a clinical trial that could help women maybe detect this easier. How would you say that?
Yeah, so the trial that we're working on is specifically for women with a genetic predisposition to ovarian cancer, very much like what Maria has. And what we're finding is that a lot of these cancers probably originate in the fallopian tube as opposed to the ovary.
Okay.
And so we're doing a study where we're offering women between the ages of 35 to 40 to remove their fallopian tubes and then at a later age remove their ovaries.
Okay.
And this is a way to hopefully maybe prevent them from developing ovarian cancer in the future while still preventing them from going into surgical menopause at such a young age.
And so that would be the biggest benefit.
Yes,
there.
that is the biggest benefit.
Yeah, I was 21 years old. Maria, how old were you when you were diagnosed?
I was diagnosed, I was 32 years old.
So young.
Yes.
And you were also, you've done a lot of treatment, you've done a clinical trial, and then most recently, if you don't mind sharing with our audience, what happened?
So yes, I've been in clinical trials. I've been, have had a lot of different treatments, and just currently I got diagnosed with a tumor in my brain that turns out to be also ovarian cancer cells.
Okay, and so moving forward, right now you're trying to figure out treatments for that. And Dr. McCann, this is the crazy thing about ovarian cancer. It's aggressive, but also for me, I had no idea I had it. Maria, did you know?
I had no idea. It's a first, I was shocked.
Yeah, you
Totally
know,
shocked.
you're just feeling weird symptoms. I felt bloated. I did feel that. I was frequently urinating, but then to find out I had ovarian cancer, it was just a shock. But that's why this month is so important to make women aware of these symptoms.
Yes, and that's exactly, and we were just talking about this before we started, is that the symptoms are so vague and it's hard for women to know. So what you experience is exactly like what most women with ovarian cancer experience: abdominal bloating, feeling like they need to urinate frequently. Sometimes they'll have weight loss, or another common symptoms, people will feel like they're full early, like they can sit down for a normal meal and after a few bites they're full and they can't eat anymore.
Yes, and you know, we have a lot of symptoms on the screen right now, which reading them, I don't want to alarm people. Every year we do this, I'm like, I know how I am. I'd be like, oh my God, I have ovarian cancer. I have all these things. But you will know, and that's how I knew is my body. I know my body, and I'm like, that is not normal, right, Maria?
Correct.
Do you relate to that?
It's, you just know your body, and something was not right.
Yes. So Dr. McCann, something important for women to consider as well, and to know, what are the risk factors of ovarian cancer?
Yeah, so risk factors include if you have a genetic predisposition or a strong family history of breast or ovarian cancer. It usually occurs, unlike Maria's case, it usually occurs in women after menopause, so later in age. Sometimes women who have experienced infertility or difficulty getting pregnant are at higher risk for ovarian cancer. And then certain women of European or Ashkenazi Jewish descent are also at risk for ovarian cancer.
It's so interesting. When I was reading these, I knew some of them, but I really did not know. And then I've also been reading on the National Ovarian Cancer Coalition. They're putting that it comes from your father's side a lot of the times. I don't know if that's accurate.
It's not necessarily true. It really, the important thing to know is that it can come from your father's side. So a lot of us associate breast and ovarian cancer with women, obviously, because they're women's cancers. And so sometimes we'll get fooled because if there's no strong family history of ovarian and breast cancer on the mother's side, then we think that we're okay. So the truth is, it can come from either side. So it's important to pay attention to your father's family history as well.
Okay. And Maria, what would be your message to any woman out there? I admire her so much. You are a lot of our community's hero.
Thank you.
How do you get through continuous treatment, and how do you stay so positive?
Have faith, believe in yourself, and do it for your family and friends. I want to encourage others. I want people to know that you could get diagnosed earlier and not go through what I have been going through, which has been a lot. And I want the signs and symptoms to be out there for an earlier diagnosis.
Yes, and that's why we're so grateful for you, Dr. McCann. You're always working so hard to support the community of ovarian cancer, and really all female cancers is what I've seen you do. So I know the Mays Cancer Center has a lot of support as well, right?
Yeah. So we offer multidisciplinary services, genetic counseling, chemotherapy, surgical services, subspecialty services. So all of that is available in what we offer. And then we also have Purple Heals, which is actually how I know Maria. And that's how I know a lot of the women in community, and we're like friends. I don't take care of Maria, but I know her very well. She is near and dear, and when we talk about her being a warrior and a true representation of what it means to fight a very good fight and be an inspiration for everybody, it's Maria.
Maria is the person. And Dr. McCann, you started Purple Heals, and I went to the very first meeting years ago.
Yes, years ago.
It's so impactful to sit there with all your fellow women who they all have a story, and you don't even think about the things they've dealt with.
Yes.
Yes.
And so thank you so much for everything you do.
Well, thank you.
I feel I have an angel right here because of you. So thank you, and Maria, thank you so
You're
much.
welcome. Thank you.
We are all rooting for you.
Thank
all
you.
of us. Let's root for Maria. Thank you so much. Dr. McCann, how can people get in touch with maybe the gynecologic oncologist department, or how does that go?
Yeah, so you can find our website on UT Health San Antonio and the Mays Cancer Center website as well. And through there, you can actually request an appointment or a consultation or ask questions. Anything that you have, we're here to help answer.
Okay, and that's why we're all wearing teal too, y'all.
That's right.
This is the color of ovarian cancer, so please wear your teal and have a great rest of your day, Dr. McCann and Maria. We'll be back in just 2 minutes on Great Day SA.